So, we have some really interesting news coming out of Business Insider today. Weight loss drugs are driving a new eating disorder crisis in the US. I have some thoughts on this and I'll share them at the end, but let's go through the article together. So, it opens by saying that Ozempic is hitting eating disorder centers hard. About 1 in 8 adults currently taking a GLP-1 such as Ozempic or Mounjaro, which is designed for diabetes, Zepbound and Wegovy, yada yada yada. You guys know the shtick. But it's this part right here that I really want to talk about. Experts warn that these medications can trigger new eating disorders, worsen existing ones, and complicate recovery. Brittany LaCour, National Director of the Clinical Assessment Intake of Eating Recovery Centers with programs across the country, said that the number of people who have come into ERC already on a GLP-1 went from 11 in 2023 to 31 in 2024, and so far there have been 14 cases in 2025, including a 14-year-old child. The ERC also said that they were seeing an increase in atypical anorexia, a form of anorexia where someone is significantly restricting calories but is of average or above average weight. Dr. Joel has seen a 25 to 33% increase in patients already on a GLP-1 medication when they enter treatment. Most, if not all of them, have a binge eating disorder. But this is where it gets interesting, and this is where I want to talk. The effects of these meds can absolutely go contrary to the goals of eating disorder treatment. So it's important to figure that out. If they are low body weight and have no other indication for use, such as diabetes or cardiovascular disease, there is no place for GLP-1 meds because the medication causes further weight loss if they are normal or above normal body weight. I feel like I have been preaching this for the last almost 3 years now. These medications are a tool and not a crutch, and it is so important for healthcare providers, telehealth platforms, everybody to get eyes on their patients before just blanketly prescribing GLP-1s. I had a really interesting experience when I first started taking the meds and talking about them on TikTok that girls with clear bulimia or anorexia were in my DMs asking how they can get their hands on these medications. People who don't qualify. And when I told them that they don't qualify for the medications because they do not have contraindication or a qualifying BMI, they got a little hostile. But I think the saddest part is that a couple of the girls I followed up with a few months later, like going onto their profile, and they had gotten their hands on GLP-1s. There are so many telehealth platforms where in which that you don't actually get eyes on a provider and the provider doesn't get eyes on you. So you can just fill out a form and say anything that you want. So that's where I think that providers who are prescribing GLP-1 medications need to take a little bit of accountability for this epidemic. Now, we all know and we all talk about the fact that GLP-1s are a tool and not a crutch. There is some internal work that has to be done when you suffer from, let's say, binge eating disorder and you're taking a GLP-1. There's some work that needs to be done to make sure that you're using the medication correctly and not just as a hindrance to your disorder. Are you doing the therapy? Are you doing the mental work? Are you talking with a dietitian? My family's practice from literally day one has had a dietitian on staff to talk to every single patient to make sure that they are eating not only healthy, but correctly and aligned with their goals. I still think that my family's practice, Slim Wellness, is one of the last telehealth providers that still requires blood work in order to get access to GLP-1 medications. By requiring the blood work up front, our providers are able to ensure that there's nothing else wrong with you, or you might have additional contraindications that need to be addressed in addition to your GLP-1 treatment. Anyways, this uptick in eating disorders of people taking a GLP-1 is 100% the responsibility of providers prescribing these medications because you need to make sure that your patients have the resources that they need to be successful. And you need to have eyes on that patient to make sure that they actually qualify for the medication that you're prescribing them.